Hey everybody, welcome back to Home and Life. Today we're going to talk about something that I've actually seen a whole lot of in clinic lately, and that is getting back into training or getting started in training because of the new year. Now, when people first begin an exercise program, one of the things that we tend to find is they try to find something that makes them feel like they're going to die tomorrow, which is understandable. It's one of the ways that we know we're working hard is when we feel like we've been pushed to the limit. Now, if you're new to exercise, that actually is probably not the level I usually recommend for people. Now, that sounds a little bit counterintuitive, like, if I'm new, don't I want to really go and make sure I'm getting the most gain out of it? But what we found is that the body's protective systems tend to rebel at those phases. And this is where a lot of things like tendinopathies, tendinitis, and overuse conditions can come in a little bit more. So, when people are first starting anything new, whether it's a new sport, a new exercise program, or even just starting with a personal trainer, one of the things that we want to make sure we're doing is, regardless of our age and how durable our body is, we want to make sure that we start with a lower level of intensity than we normally would have, and a lower frequency than we would normally prescribe for someone in that age range. What do I mean by that? When we take somebody who is a standard fitness activity level, what we're looking for is they should be doing about 3 days a week of some sort of moderate to vigorous intensity cardiovascular activity for somewhere between 30 and 60 minutes a day. 2 days a week or more, they should also be doing some sort of weightlifting activity of up to 10 exercises at a relatively heavy load between 8 and 12 repetitions. Now, this is someone going through an average program. However, when you're first starting, if you lift too heavy, too often, or if you're doing your cardio too heavy, too often, what we can find is the development of a variety of conditions, things like patellar tendonitis, patellofemoral disorder, or overuse conditions of the rotator cuff. These are some diagnoses that I see fairly common, especially at this time of year. So, what do we do about that? How do we know when we're doing too much, too fast, too often? One of the things that we try to use is our rate of perceived pain, both during and after a workout. We like to imagine that scale of 0 to 10. When we look at the 10 side, this is about to die, need to go to a hospital, cut the limb off. 0, of course, is when you're in no pain at all. Both during exercise and over the 48 hours afterwards, we should feel pain no more than 3 out of 10. That should be a mild discomfort, soreness, nothing that makes you feel like you have to crawl upstairs. If we're hitting that point, it's our body's way of saying, oh my gosh, that was too much. If we keep pushing at that same level, pain tends to act like a small child that's trying to get your attention. If you pay attention to it and do what it needs, things get taken care of and we're all okay. But if we try to push things off, you're going to hear that noise louder and louder and louder until you finally have to pay attention. And that's where full-blown tendinitis can come from. So, when we're first getting into exercise, if we're starting to feel like, oh my gosh, I feel terrible, we actually want to back off a little bit. Maybe lift at a lighter load for a short period of time until our body is able to hit that load without being so painful. Now, I'm not saying you shouldn't be sore. Like I said, a little bit of soreness can actually be a good thing. It's how our body knows to adapt. But if we push too far past that, we're starting to push our body's limitations more than it's ready for. And our body needs a certain amount of time to recover. When we're first beginning exercise, if our body's not attuned to that recovery phase, it actually takes longer. So we want to give our body up to 48 hours of rest in between sessions, whereas a normal rest period would be about 24. Now, that's perfectly okay. But when we're getting back into things, if we've taken a long time off, somewhere between more than a couple weeks and a couple months to years, our body's going to revert to that. We're going to need that longer rest period again. So one of the things I advise people to do when they're starting to get back into things is also monitor our rest breaks. Make sure you're taking a nice period of time off. You won't get the most benefit possible of exercise if you're taking only 2 days a week of exercise, but you're going to let your body adapt to it better so that when you can hit intense, you can hit as intense as possible with less risk of injury. And that is, of course, one of our big things we'd like to see. Less people getting hurt so they can stay active for longer. If you guys have more questions about how to get started on exercise programs safely or get started into a sport safely, let us know. That's one of our jobs in physical therapy, is to understand the athletic conditioning side of things, whether it is for our daily life or for a particular sport. And it's actually the type of patient that I really enjoy working with because it's the people who are most excited to get moving. If you guys have other questions regarding other things, of course, please always feel free to comment or shoot our page a message. We always want to be answering questions on the things you want to learn about. So we'll talk to you soon, and hopefully about something you're really excited about.